is again something which you have to have a screenshot of this. Remember this. Let's first understand the steps, the algorithms, and then we are going to go in for CPD design. In your answer sheet, you have to draw an accurate diagram of the upper and the lower arch or the cast, depicting your edentulous case and writing your final classification. The sequence of the choice of components and thereafter the CPD designs has to be followed like first is the rest, which are in red, then your retention components, that is direct and indirect retainers, your connecting components, that's your major and minor connectors, your denture base and your choice of denture base materials, your selection of teeth and your occlusal scheme. And if you need any form of stress directors, then you're going to be mentioning those as well, that is precision and semi-precision attachments. Then you have to mention that what is your nature of support. Is it going to be tooth supported, tissue supported, or tooth tissue supported? Now, primarily tooth supported is a class 3 situation. A tissue supported is a class 1 or a class 2 edentulous situation. A tooth tissue is something which you don't have an extensive edentulous span. Mention your philosophy of design. As I told you, the 3 philosophies of design have to be mentioned. If you have a functional impression that needs to be done, point number 5, mention that you have to do a functional impression and then draw your diagram with a completed CPD design. I'm going to show you how your diagrams look like, a schematic representation in your following slides. So this is what, click a screenshot. This is how you're supposed to follow if you have to design a cast partial denture or you've been asked in your Viva, how are you going to design? This is the sequence that you're going to follow. Now let's look at the first scenario. Look at this clinical picture on the top. It looks a typical maxillary Kennedy's class 1 situation. And if you see the design here down, then you can see it's a complete palatal plate, which is going to be my major connector. Then my lateral incisors have aesthetic class because obviously it's a lateral incisor. And this clinical picture here. It's a class 3 modification 2. You have a pyre abutment in the center here on the premolar on this side. So this is your pyre abutment. Okay, this is your class 3 modification 2 areas. So now you can have in this region, you can have a circumferential clasp, as I told you. Here you can have your I-bar approaching clasp for your aesthetic clasp. Your pyre abutment, you're just going to have 2 rests. You're not going to be having any clasps on your pyre abutment. Again, a circumferential clasp here and an I-bar or an aesthetic clasp here. So this is how you're planning. Anteroposterior palatal bar is going to be your major connector. As I told you, that anteroposterior palatal bar are the favorite kind of tooth tissue supported kind of major connector. So that's your design down on the right, and that's how you design a typical situation of a class 3 modification 2. As you can see, I've already explained to you. That's your schematic diagram down on the right. You go to the next one. It's a class 4 situation. As I told you, class 4 has no modifications because that's your anterior edentulous vein, which is crossed in the midline. A class 4 situation, it's a closed horseshoe is a major connector, which is your major connector of choice. Now, as you see here, if you can see particularly, this is going to be my major connector. That is going to be my closed horseshoe major connector. I have my abutments here and here. So when I have this canine, I want to use, for the canine, I would use an aesthetic clasp for an I-bar approaching clasp. And for the premolar, I can use a circumferential clasp for an I-bar depending on the aesthetic zone. So that's what is my choice of component, and that's how I'm going to be planning. Obviously, in the region where I have my edentulous span, my minor connector is going to be a mesh work. Remember, in my class 1 and class 2 situation also, give a minor connector which has the need for relining. You can give a ladder or a mesh work kind of a design, never a metal on the edentulous spans. So that's how I design my class 4 situation. Then I go to the class 2 modification. This is a mandibular arch. As I said, if you have enough depth of lingual sulcus, you can use a lingo bar. And then this is a class 2 situation which will require or necessitate the use of an indirect retainer. This is my fulcrum line, right angle. So I have a canine rest which is going to act as my indirect retainer, my lingo bar, This is going to be my RPI clasp. So this is my tooth for my RPI. And maybe I can use a circumferential clasp and again a I-bar clasp. So this is again the design. As I said, your RPI is your choice of component when you have a class 2 or a class 1 Kennedy's class 1 situation. So that's something very, very important again that you all must remember. So as I said that in this situation, an RPI clasp here on my abutment tooth, which is my distal abutment tooth, an indirect retainer, which is right angled, that is a cingulum rest or a canine rest on my canine, which is at right angle to my fulcrum line, and my two other direct retainers, which can be an I-bar approaching clasp and occlusally approaching clasp. So this is my tripodal kind of design, which I'm using for my direct retainers, and lingo bar is my major connector. Don't forget, minor connectors are linking all the components together. Okay, so this is a typical class 2 modification 2 situation design. Modification areas also act as indirect retainers, you must remember. Next, we go to a class 2 modification 1 design. I've shown the difference because if you do not have depth of lingual sulcus, you use a lingo plate. Lingo plate, again, this is an extensive edentulous span, so you have to use a lingo plate which is covering the entire area. I want to use, this is one sole isolated molar. I will use a ring clasp for the isolated mandibular molar of mine because it acts bracing. It's a bracing component. Then I have my premolar here. I have my canine, both my premolars here. So I use an RPI here. I use an RPI here. I can use a combination clasp as well. And my indirect retainer is obviously going to be my lingo plate because my lingo plate is going to be covering all the cingulum of my anterior teeth. So that's how I design my extensive class 2 modification to modification 1 situation here. So to repeat again, a lingo plate is my major connector as well as acting as my indirect retainer. My RPI clasp on my premolars I can use a combination clasp if there's a soft tissue undercut as my direct retainer, and an isolated molar which I have here, I can use my ring clasp. So that's your choice of design in a particular class 2 modification 1 situation.